Really, the first is to identify patients who are potentially at risk. So that means looking at patients with liver disease. Well, let's back up a step. It means identifying patients with liver disease. So it means finding all those in the community who have hepatitis C, who have hepatitis B, who have non-alcoholic fatty liver disease. That in itself is a huge task. Let's assume that that can be achieved. Then you need to look at which of those patients are at risk. Do they have cirrhosis? Because that's the first and most important risk factor. And then those who are not cirrhotic, what proportion of them are at risk based upon these risk scores. Next step is to institute regular screening. The recommended interval is 6 months, and to ensure that that gets done regularly. I mean, there are screening programs or screening protocols all over the place that have 3 months, 1 year, and patients may or may not come, and it's not done religiously. And if you don't do that, it's not going to be an effective program. There's still the issue of what test we should be using, and at this stage I would say that in good hands, ultrasound is still the test of choice. Trouble is that if you have obesity, you have cirrhosis, it becomes much harder to get good quality ultrasound. And in the community, generally, the quality of ultrasound is perhaps not as good as it should be. And so I would like to see that facilities that offer liver cancer screening are accredited the same way as they do for breast cancer in many centers, so that the quality can be assured. So that's what it would take to get a program going. And of course you want, the metrics, you want to be able to measure things and know that you're doing things the way they should be done.